Your job is not to put them in the perfect condition. Your job is to get them to the point where they're safe to come back, but then also acknowledge here are the risks associated with that. Hi, everyone. Welcome back to the podcast. Welcome, all new listeners. Welcome back to those who have heard my content in the past. I am actually very excited about this topic. It's probably one of my biggest passions. I might say that on every podcast, but this one topic is one of my favorite topics. Before I get into the podcast, let me give you some just general updates on what is happening with me in my life and all good things. I've been swamped, absolutely swamped every day. Just been dreaming about our new location that is opening up in San Diego, just a little north of the airport. We have in our second location opening up in 10 days from this recording. We have a soft launch in 15 days and really, really excited. So I've been working on everything that it takes to start up a new facility, from flooring to organizing paint to contractors to electrical work to, I mean, you name it, internet. And it's been a thrill, and I'm very grateful to have the support from the team and everybody here who's really helping and being a big part of that along the way. So that is really what's been going on, and I've been off of media, and I've just been trying to crush it as much as possible. So humble beginnings. I'm very, very appreciative of everything that's happening. All right. Nonetheless, let's get on to the podcast. So why am I talking about this podcast? What brought it out? So we had a team meeting on Tuesday, and we go round robin. You know, if there are any tough cases, what do you have? And that we kind of all switch our brains onto. You know, everybody has a different specialty, but like, what would you do? How would you add value to this case? And it was brought up on an acute AC joint sprain, and this is a football player. I think a receiver. So when they land, the concern is, you know, if they have a fresh, you know, grade 1 AC joint, what are you going to do? And, you know, we can apply this to AC joints or whatever it is that you want, but ultimately, how do you know when an athlete is ready to safely return to sport after injury? I know this is a really tough question because, I mean, you got to know the scenario and, you know, the athlete and age, and there's so many variables, but I wanted to break this down into how I process returning athletes to sport. And I know I said this earlier, but this is one of my biggest passions. I love it. And what I love is it's a puzzle, and all you're trying to do is add as many pieces as possible so that you can get this person safely to return to sport. But I'm going to bring up some interesting topics that I truly believe that make it very difficult for people to 100 confidently, 100% make sure that somebody's safely returning to sport. And it's very, very difficult, and I challenge you, if you think like, oh, I can do that, I understand, but there's some elements that you need to be aware of. I've done it at a high level with pro sports, and it's every week in pro sports you're managing that. Some days it's a fresh hamstring that's going to take 6 weeks, but you know that you're trying to get them in as soon as possible in 3 weeks or 4 weeks, and they have a game, they're a role player, and they have to be in that position. It's very, very challenging. You have an AC joint 1 week old going into a football season, there's very, very tough scenarios. All right, so this athlete, their receiver, AC joint sprain, and the concern was this is an AC joint that was 4 days old going into a game, a playoff game, and so the AC joint is a concern. How do you rehab this? Do you exercise it? Do you rest it? Do you anti-inflammatory? Do you ice it? What do you do? And if you put 20 PTs in the same room, everyone's got something different, right? They're like, oh, you got to do this bear crawl exercise. Or one of the ones like, oh, you just leave it alone. Another one's is like, you tape everything like duct tape. Another person's going to be a super like soft tissue, and these people, like your group of friends, like you have one of each. And I love it. And if you ask me which one I'm kind of like the Switzerland of PT. I am I'm kind of like the hippie. I'm like, that's good, and that's good, and that's good, and that's good, and I'm just gonna do it all, and I'm just gonna float with the wind, and I'm gonna put it all together. That's where I'm at. As a younger clinician, my drive was more towards, I'm a very heavy soft tissue guy. But my career started in movement. I thought movement can fix everything. And then you get into pro sports and you're like, oh, you need to be able to play this week, or like you're not a chronic injury. It's just challenging. I can't insert that within the day of, or the day before your your game. Like there's just some things that you can't do. And then I had to learn like more athletic training style taping, and I had to put all these elements together. So now I'm more of like I'll do a little bit of everything. Show me more tricks because I just need to know where it fits in my recipe. So AC joint, 4 days old, and competes in 3 days. What do you do? How do you know that they're safely going to return to sport? Maybe maybe don't do exercise. Maybe you tape them. Maybe you exercise them hard. What do you do in a very short time like that? So I'm going to break down some principles that I use, and then you can generally apply it to whatever case that you're going to try on. So let's go with the two that are very, very common. Criterion and ACL. At week 12, when are you starting your running progression? How did you determine if you're starting running progression? Is it single leg step downs? Is it hop testing? Is it straight leg raises? Is it quad girth? I mean, there's just so many tests that you can do. Is it biodex testing? I mean, is it hop testing? What are you doing? Vertical, linear? And then once you do your running progression, when are they appropriate for plyos? Is it knee strength? Is it dynamic knee valgus? Is it hip strength? Is it closed chain? Is it open chain? All those pieces. And I'm not here to tell you which one is which. I'm just saying generally most of us will use as a basis criterion based progressions, right? Like you can now do single leg stance for 30 seconds, eyes open and eyes closed. You can go up and down the stairs reciprocally without pain or upper extremity use and no significant movement faults. So you're now ready for insert the test. Criterion based, I think we all use it. Great. I think you have to have those at every mark. All right. Next one is time based. The criterion based has to work, right? But if that were the case, you can just take somebody a year out and be like, oh, I got them easily to where they wanted to be. However, there's a time based component to that. So the hard ratio is when can you insert criterion as soon as possible within the fastest time-based progression. So time-based would be, every 4 to 6 weeks you're adding a new block or a new timeline for them to be able to do that. So if in an ACL progression in 4 to 6 weeks that you're hoping that you're doing more closed chain, and within that 6 weeks you're doing closed chain strength building into linear running, and for those next 6 weeks you're doing linear running with linear plyos, and after those 6 weeks you're going lateral and multi-directional, and then by that time they're doing modified practice without contact, and in the next 6 weeks you're doing contact with still modified practice, and then you're doing contact with no modification in practice, and then from those 6 weeks you're doing full return to sport. So those are time-based progressions. Now somewhere along the line, criterion meshes with time. That's really good. I think we will all run into trying to mesh those two together. Criterion and time have to be able to go together. And the big one that I will say that I think a lot of people don't put a lot of emphasis on, and you've heard my podcast, it's one of the most important determinants. There's subjective report percent improvement or rating of them going back into sport. So what I mean by that is, hey, I know you're 6 months out and you've hit these criteria, which is great, and you're 6 months out and that's your time-based return. You look appropriate to go back to sport with modifications, non-contact. And they say, you ask them, what percent improvement do you think you're? How close to 100%? That's an easy way to do it. How close to 100% are you? And they say 80. Whoa, they're definitely not ready to return to sport. Why? Because even if you did all the criterion, all the time-based progressions, and those look phenomenal, their subjective report will put them at a disadvantage because they don't believe in themselves yet. So my general guideline is you have to be 90% to return to sport, assuming that you've hit the criterion and time. Subjective report, criterion, and time. All three of those have to just mesh beautifully. Now, there's a fourth component that I will add into my personal equation. So I know that time-based, they're ready. Criterion, they've hit every mark. Subjective report, 90%. The last element that you have to put, that if you're asking me, Chris, what's that? How do you know if somebody's ready? The level of urgency is also a factor. So let me tell you worst case scenario. If you have an athlete who time-based, They have a short time. So if we're talking about this AC joint, they have a short timeline, not ideal. They haven't hit the criterion and there's high amounts of urgency. You got to ask what their subjective report is because that might trump everything. I've seen it. And sometimes they just do it. And you got to give them the benefit of the doubt. And the qualifying word that I have is safely return to sport. Now, they got to believe it. They have to believe it. And I've had this before. I've had athletes who it's a grade 1 hamstring strain, mid belly, and it's 3 weeks out. I'm like, there's no way. You're going 6 weeks. This is 6 week. I don't. We can do all the magic. We can do dry needling. We can do acupuncture. We can do laser. We can do every modality, every rehab progression. Try it. Tell me that grade 1 is magically going to get better with some insert whatever thing that you think that you can do at a high level. Pros, and the demand is that high, and they need to be able to go all out sprint, no hesitation, and what they do is carry the team and they're a role player. It's very difficult. So urgency is a different element, and where the qualifying factor that subjective report can override that criterion and the time-based is their subjective report. So for instance, we have this person who has a grade 1 AC receiver. If they come in the day before the event, and yes, it's only 7 days of healing, and this is going to be an irritant, and their criteria, they still have full range and it hurts to do it, but they're like, hey, you know what? I'm 90% better. What does that do? It overrides that. So what you need to do is give them a chance. I understand we talked about safely. I get that. However, your job is not to put them in the perfect condition. Your job is to get them to the point where they're safe to come back, but then also acknowledge here are the risks associated with that. These people are adults. If you're working with youth athletes or high schoolers, you have to let the parent know that. With that, you're making the right decisions. All you're doing is putting them in the best possible scenario. Set them up for success. And if you don't do that, that's where you're failing. So you can have somebody who says, I'm 90% better. It still hurts with this and that. I understand I can't raise my arm, but I want to play tomorrow. And you do all the testing and you say, hey, listen, your strength doesn't match that. Your parents are telling you this. I'm telling you, I wouldn't advise you to do that. However, if you're saying you're 90% and you feel ready to play, explain to the parent or explain to the athlete, this is the risks that you take with that. And I've had athletes come back to me and they just did it. I'm like, how did you do that? It's so rare. You're an outlier. But you have to know those 4 components to putting, if you're talking about, and I'm not just talking about orthopedic PT, like not your typical 6 weeks to 4 months where insurance covers it. I'm talking about higher level athletes or an athlete who has high motivation and it's beyond what your normal caseload is. Like these are the cases that you can save, that you can have a big component in them returning to sport, like achieving their dreams and whatever it is that they have that brings you that joy and that fulfillment, that excitement. Those are the cases that you love, and I know that because you're listening to this podcast. So because of that, you're going to have these random cases, and that's where you can put in your secret sauce. Like these are the elements that it takes to get a high level athlete back. It's decision making based on components that you're given, and this is where I said like these are just puzzle pieces. You're like time based, oh, that doesn't really fit. Criterion, okay, you're doing great, but we don't have the time that you need. There's high level of urgency, and their subjective report is not meeting 90%. They're at 70, not ready. Just it's easy. They're just not ready yet. Put them through a test. They're going to have a flare up. So those are the 4 components: criterion, time, subjective report, and you have to include urgency and what their level of motivation is. To me, when I put all of those together, it helps me determine what the level of success is, and then how good am I forecasting if this person can do it or not in the timeline that they may have. On my last podcast, I spoke about a post-op post-op proximal biceps tendon repair, and they were able to go back to full throttle CrossFit within 8 weeks. The one exception, not full load, but gymnastics based like bar muscle ups, versions of kipping, pull-ups, or whatever it may be. So a high amount of torque, high amount of load, but body weight. They were able to build up strength over the next 4 weeks. So 12 weeks to get up to strength, 8 weeks to get up to gymnastics, and then from there conditioning. So when you get these outliers, it shows you that, wow, maybe I did a disservice to my last athletes or my last patients or my last clients, that all I could have done is give them better options, give them a better chance. And that's where I think that if you're a PT student or a new grad or experienced, and you're like, I've worked with athletes my whole career, listen, I'm not telling you you're doing things wrong. I'm telling you that there's different elements that you maybe have not seen because you haven't been exposed to those environments. And I'm telling you, they exist. And the best thing you can take from that is, I'm not trying to override what you know. Add it to your secret sauce. Add it to your equation. And that is the person who learns, who's willing to accept other opinions and say, actually didn't think about that. I'll consider that for my future athlete. Or it gives you an opportunity to better serve your people, give them better chances of outcomes, better chance of success. Those are the providers who are going to be successful. You know who's not? The person who's been doing what they do for 10 years, haven't changed a thing because it works. It only works for people who are 6 weeks post-injury to 4 months post-op, because that's all we know as typical orthopedic PTs. That's it. That's a secret sauce. 6 weeks to 4 months. Why? Because insurance will typically take that on. It's very difficult to get a 0 to 6 week athlete or injury because of the time it takes to get see a physician and everything else. And then it's really hard because insurance is after 4 months. It's really hard. So what do you do with a 9, 10, 11 month post-op ACL? What do you do with that person? How do you know that if you're the person determining if they go return to sport, their physician probably cleared them at 9 months. Go ahead and do your thing. They still have quad atrophy. They still can, do a single leg squat very well. They still have dynamic knee valgus, and they've been working with a personal trainer, a strength coach, and they're doing their best. However, there's a missing gap. And that's where somebody like yourself can partner with other people who say, like, listen, I don't think they're ready. Here's a criterion. They're 9 months. Yes, in theory, time-based, 10, 11 months, based on your physician, you might be able to return to sport. However, criterion-based, they're still not there. Their quad girth is still not there. Their single leg hopping, landing, plyos, vertical hop testing are still not there. And their subjective report is still at 80%. They're definitely not there, and there's no urgency. So why would you try and push that? So when you put those 4 layers together, you have a good equation on how to determine if an athlete is ready to go. So what about a post-op, 13-month ACL, or a post-op rotator cuff repair who's 14 months out and they want to go back to high-level athletics or pitching, and they're still having pain. They don't have full external rotation yet. They don't have symmetry. They still have scapular winging, but they're 14 months. So they hit the time, but the criterion's not there. And maybe they hit 90%, no urgency, but the criterion is not there. So when you look at all 4 of those, it's going to be a game changer for you determining, am I doing the right thing? And that's pretty much what you're always asking yourself as a provider. I just gave them that homework. Was that the right thing? Should I have done that? You're always going to question yourself. It's just the nature of who you are. Like, people you're like me. Every day, I'm asking myself, did I make that right decision? Did I coach that properly? Did I lead the team that way? Did I serve my patient or client the right way? Dang it, I flared them up. You know how many times I've flared up people and I just felt horrible that night? It feels horrible. And I hope you don't get to know what that feels like too much, but it's one of the worst feelings because you work so hard at your craft to do things right, and you take the con eds, you listen to these podcasts, you read the books, and you put it into your equation. What you were missing was something behind the story you missed, that you went forward with the technique or progression that was a little too much, and that allowed you to flare them up. And what you were missing was a piece of the puzzle that you only could see after you flared them up. You're like, you didn't tell me that you were going to the beach and you were going to be in the waves. I knew you were going on vacation, but I didn't think that after a knee meniscectomy that you would have gone in the water. I should have told you, don't go in the water 3 weeks post meniscectomy, because I knew you were going to be unstable and you weren't ready. I'm just making up stories, but it just helps put it into context. Ultimately, I've had certain scenarios where I've made mistakes transitioning athletes back to sport. And I've always reflected every single athlete that I've ever flared up or been successful with. I've asked, why did that work? Instead of patting myself on the shoulder, I was so skeptical. Wait, that worked exactly where I predicted. Why? Well, their time worked out great. Their criteria was hit. They were above 90%. And the urgency factor wasn't big, or it was a big deal. Most of the time, the ones that don't work is where there's a high amount of urgency and they still haven't hit the time, and maybe they hit the criterion. The time or the criterion may still be a factor, but their subjective report was high and they convinced you. That's where the error happens, is when there's urgency and they say yes, but that's all you can do. And that's what I want you to take home, is sometimes you can only do so much. And it's the talk that I had with the team that, you're doing the right things. You tape it, you don't flare it up. They're within 3 days of the activity. It'd be hard for us to overexercise. Excuse me. It would be wrong of us to overexercise them. Just allow them to transition to sport. Give them the bumpers, the guidelines. Hey, I wouldn't play the whole game. I'd play half. See how that feels in the first half. Talk to the coach. Let him know that you're going to come in at 90%. But if you take a hit, he's got to have a ready, somebody on the back end ready to rock and roll. And that way, at least there's an opportunity for that person to play. And you let the parent know, or you let the athlete know, and this is what the risks are. And I think that sets them up for the most amount of success. And you're like, hey, not ideal. You can use another week. You tell me you're 90%. Your strength is 75. I think you can mess this up. I understand that this is something you want to do, but understand if you do this, it'll set you back 2 weeks. So I don't know when your next game is, but if you do and this works, good for you. But you're still going to come back here on Monday because you're going to have a little bit of irritation, and I don't want you to flare it up even more. So when you do that, you lay out this plan, and the athlete loves it. They trust you, but sometimes you're going to mess up. But the best thing you could have done is communicated what those possibilities can be, so that that person feels secure that they are making the right decisions. That's all they're trying to do. You're not their parent. You're not their direct report. Your job is to set them up for success, and that's all you have to do. And sometimes we carry that burden. It's very, very true. Sometimes we take on that brunt of that force, and we feel really bad because we probably spend the most amount of time with them. That's just really what it comes down to. We start to get to know them as a person, as a human, and we know their likes or dislikes. Maybe their girlfriend, their boyfriend, their parent, their mom, dad, sister, whatever it is, and you start to connect with them, and that emotional connection needs to be separated when you're talking about safety. And that's where the disconnect is very difficult for a lot of us, because we're very empathetic human beings. We care, and what that does is it makes it very difficult. And when you're working in the pros, objective is king, because you need to make the right decision, because there's layers of triaging of, if this doesn't work, it's coming right back to you. And all you can do is set yourself up for success, document that, let everybody know that this is the repercussions. They're deciding this on their own. And that way you did the right thing. You did what you could do. And that's your job. You do what you can do under the circumstances and with every piece of the puzzle you had. And as you mess up more, because you will, I hope that you learn to get more puzzle pieces to help put that whole map together. And ultimately, sometimes you just listening to my podcast, all you're doing is getting more puzzle pieces. Like, I didn't think about that. Wait, why did you do that? It's not the exercise. It's the time-based. It's the timelines. It's the criteria. It's about understanding where this person is. How did you make that decision? Why? Higher level processing, so that you can think better and have your athlete set up for success. It'll set you up for success. I promise you that. So I hope that helps. Think about your 4: criterion, time, subjective report, and urgency. Put those in your equation. Tell me your success stories. Send me an email. drchris@drchrisgarcia.com. I love celebrating this stuff. I got an email recently on my last podcast. Hey, that was helpful. I had an athlete that was very helpful for just kind of putting that into their algorithm, and that was helpful. And just it helps me understand where you guys are at and create better content for you. So send me an email. Let me know how life is and how it's helping you along the way. All right, guys, I am off to hang out with my family and actually the team. So I'm really excited to hang out with them tonight. All right, I will catch you guys on the next episode. Take care. See you guys.